Okay. Should we introduce ourselves?
Yeah, sure. Hold on. Hi, I'm Alexa.
I'm Amanda.
We're a disaster.
Okay, let's start it one more time.
Oh, God. Take two.
Tatas and tea.
I'm Alexa.
I'm Amanda.
Welcome to Tatas and Tea.
What a journey it has been this week. I ended up in the hospital. That was a fun time. I have been getting allergy shots and I missed about a month's worth of shots. And so I had to go backwards in dosage. And apparently my body did not like that. And so after I got my allergy shot, about 2 hours later, had shortness of breath and I was wheezing. And I was like, it's okay. I'm just having anxiety. And then half an hour later, it wasn't better. I looked in the mirror and my face was bright red and I was covered in hives.
Oh, my God.
So I called my doctor and they were like, you should probably go to the emergency room. And I was like, I don't know if it's that deep. Is it that serious? And they said yes. And I asked if I should take my EpiPen and they were like, no, you don't have to. It's fine. So I didn't. And then they called me back and they were like, you need to take your EpiPen. But I'm so afraid of EpiPens and having to stab myself, which you know.
Yeah.
Because you had the stuff with IVF and IUI, right?
Yeah, for both. But I never did it myself.
Yeah, you had Christina do it, right?
I was EpiPen certified or whatever, trained.
Oh, really? Is there a training for that?
At work, I was.
Fancy.
But I know you just stab the thigh and wait 5 seconds or something like that.
Yeah.
Right. But that is scary to do it to yourself.
Yeah, no, thank you. So I was like, well, if I do that, do I have to go to the hospital? And they said, yeah. And I said, I'm going to skip that. And I got there and I was like, I can't really breathe. And I'm bright red and covered in hives. And they were like, okay, have a seat. We'll be right with you.
Meanwhile, you die in the ER in the waiting room.
This is
Oh my
fine.
God.
Good thing it wasn't more serious where
Right?
I was really, because I had taken another allergy pill. So I already was kind of feeling better, which I told my doctor on the phone. And they were like, yeah, it's the shortness of breath that is really concerning. But let me tell you, I felt like I was on a real life episode of Grey's Anatomy in that ER. Because have you ever seen Grey's Anatomy?
I mean, Christina watches it, but I never have. I've seen parts of it.
Okay, so it's basically this big room and a bunch of curtains.
I know exactly because I was in the ER, the same ER for my belly button.
Oh, really? So but you could hear everything.
Oh, yeah. We heard everything. Yeah.
There's no privacy at all. I'm sitting there, and here's the kicker, too. I'm like, I can't breathe. They ran my oxygen, and they were like, you're fine. I was like, I know, but I'm struggling. It hurts. And at any moment in time, my allergies could have gotten worse, and I could have keeled over, and they wouldn't have known.
Right.
Because they close you in the curtain.
Yeah.
And they don't check on you. I was left alone for half an hour, 45 minutes before the PA came in. Anyway, he comes in, and he's like, what brought you in? And I told him, and he kind of was like, I don't want to say he was rude, but he wasn't very pleasant. He seemed annoyed that I was there. He gave me medication and it was fine. And I was already feeling better. But there's a woman that came in. She comes in complaining about her back and he's like, well, I can give you medication. And she was like, I don't like pills. So he said, okay, I can give you an injection in your back. I don't want an injection. If I wanted pills or an injection, I could have gone to pain management. And she didn't say it like that. That was rude. But that's how he interpreted it. But she was frustrated because she was asking for help. And I don't know if she wanted an MRI or an x-ray or something because she had just had back surgery. But he was so rude to her. And he was like, well, if pain management could have given you these things, why didn't you go to pain management? And she was like, because I don't want those things. They got into it. She left. And immediately he starts going around to all his coworkers talking shit about her. That woman was so rude, blah, blah, blah.
And you could hear everything.
And I could hear everything. And I could hear the whole conversation between them. And she wasn't rude. I can feel her frustration, I guess. But she wasn't rude about it at any point in time. He was being rude to her. And I don't know if he thought she was a pill seeker, but he was so rude. And he was talking shit about her to everyone. I must have heard him tell this story 4 or 5 times. And it got worse as he told it, more dramatic. And so then I guess she had forgotten something. So someone came in and was like, oh, she forgot whatever. And he was like, make her wait. She was so rude to me. And I'm just like, how horrible of a person to be working in an emergency room where people are already really, really vulnerable.
Mm-hmm.
Like, I don't know about you when you went,
Mm-hmm.
but I hated having to go. I thought I was overreacting, and I thought I was going to be judged for going to the emergency room for something seemingly so small.
So I went to the ER. I was 7 weeks pregnant with my other pregnancy. And in the middle of the night, well, it was funny. I got a new pillow from Costco.
We love Costco.
So I was using it for the first time that night and something wasn't right. I was like, oh, I have like a pain in my side. I was like, fuck this stupid pillow. I said, I hate this thing. Like, I threw it on the floor and I like got my old pillow or whatever. And it like continued. Like, this pain was so bad. And I kept going in the bathroom to pee. I was like, maybe it's like a kidney stone or whatever. I'm like, I have no idea. Maybe like I was constipated. I didn't know, but I never had it. So it just kept getting worse and worse and worse. And Christina's like, you have to go to the ER. And it's like 3 a.m. or something. I'm like, I don't want to go to the ER. And then I got really sick and I was like, I felt like I was going to throw up. Like, I was nauseous. The pain was so like bad. I couldn't lay down. I couldn't sit up. I couldn't stand up. Like, I was like, okay, we have to go. So I went and I told them, I was like, I think it's a kidney stone. It took forever to do anything. I'm just sitting there in pain, like pacing back and forth in the room. In the ER in the waiting room before I even got in, I was so sick I was throwing up. I brought a garbage bag. They found out that it was like gallstones. And they're like, oh, well, there's nothing you can do for that. Because I'm 7 weeks pregnant.
Yeah.
They couldn't give me pain medication. Like,
Nothing?
they put an IV in me and just did like fluids because I was dehydrated from like both ends coming out. Like, you know, I couldn't stop. And then he's like, yeah, it's unsafe to, you have to have it removed, your gallbladder, but it's unsafe to have it removed during pregnancy.
And you were only 7 weeks?
7 weeks.
Wow, that's so early
I was so
on.
nervous.
Yeah.
I was scared. I was like, what if it was something with the baby? I didn't even know. So yeah, it was so early on. And the nurse gave me Tylenol to take, like just pills, because that's the only thing you can take. So I took the Tylenol and I threw it up. Like, he had the bag. He was holding the bag for me. And I threw it up, and he had to check my vomit to make sure the pills went down and not in the bag. And he was like rubbing my back as I was puking. I'm like, oh my God, I felt so bad.
That was nice.
Yeah, so that was fun. I had my gallbladder removed after I gave birth, and my surgeon was on vacation. And of course, my incision was like through my belly button. I had the worst infection. It was cellulitis. So I went to urgent care because I'm like, this is not like an emergency room like situation. And they're like, they gave me all the medications and stuff. I kept calling the office and the woman was like, oh, just put Neosporin on it. I'm like, number one, I don't even use Neosporin. Like, that shit is terrible. But I was like, I'll listen to whatever she says because maybe this is like normal. It was just getting worse. She's like, all right, you need to go to the emergency room. But I'm like, it's not an emergency. Like, I felt weird going in, but it was just because my surgeon wasn't physically here. So I had to go there for the other surgeons he works with to look.
Right.
Like, they came down and like looked and they were just like, yeah, continue taking what urgent care told you. It's not like if it was worse, we would have to cut it or I don't know, but whatever. I was like, thank God they didn't have to do that, but it was really bad.
Yeah. But you kind of feel like not stupid, but foolish almost. People are going to the emergency room because they're dying.
Right. And here I am.
Yeah.
Yeah. And there were other times in that pregnancy, I had the same exact gallstone attack. OBGYN officer, like, you should have gone in. Like, it could have like affected the baby, like, you know, like, you never know. But I'm like, I just hated the experience I had because it was just like,
yeah,
they didn't do anything.
Yeah, I felt stupid going, and like, I can still breathe. It hurts, but like, I'm still breathing. It's fine. But yeah, they just gave me prednisone and then an antacid. I was just like, I clearly didn't need to go in for that.
Right.
But it could have been an emergency, you know?
You don't know how bad it's going to be. And you've been having reactions.
Yeah. I mean, it was scary. The hives are what scared me, not even the shortness of breath, because I was like, maybe it's anxiety. And that's the other thing. I remember I told my friend about it, and she was like, I understand where she was coming from when she was like, oh, are you sure it's not anxiety? But also I was like,
saying that you're like a liar.
Right.
Like,
well, like,
much.
I'm
like,
overreacting.
Yeah, right.
Yeah. And that's kind of how I felt initially when I was having the reaction. I was like, it's probably anxiety. I'm giving myself anxiety. I'm overreacting. I'm glad I went, because if I did die or like was gonna die, at least it was close to help, I guess. I don't know. Anyway, but it was a time, and there was so much drama happening, and it's just like this PA was kind of dismissive of this woman's complaints, and then another girl came in. She was younger, and she was having chest pains. And so he started asking her all these questions and was like, well, what about work? I think he thought she was having maybe anxiety or a panic attack or something, because she was like young and relatively healthy, I'm sure. She was like, oh, I'm not working. And he was like, well, why not? Then she was like, honestly, I think I might just be dehydrated. And he was like, well, why do you think that? He was just so rude about it. It's just so frustrating because you go there because you're asking for help. And so to be treated like that, it's really sad. If you don't want to help people, why are you going into this profession?
Right.
And my mom always says the worse their bedside manner is, the better of a doctor they are.
Really?
Yeah, that's my mom's experience. I don't know that I agree with that.
I mean, the surgeon who did my gallbladder, he was like straight to the point, and that was it. Like, that was his personality. But he was a great doctor. But like, when I was pregnant, they were like at the ER, they're like, you have to go to a gastro. So I went to her, and she literally didn't even touch me, didn't even like, she's just like, oh, I looked at your charts, and you have to eat a no fat diet. Like, if you have salad, you cannot have olive oil on it. And I'm like, bitch, I'm pregnant, number one. And I'm having a million food aversions. Like, I won't eat chicken. I won't eat this. I won't eat that. So, like, whatever I am eating, like maybe pizza, like here and there, like obviously anything could set me into an attack. And I had the whole pregnancy to go. So I was like, shit. But I was trying to really watch what I was eating, but it was impossible. And she's like, yeah, you're going to need it removed after you have the baby. So I was like, do you have any surgeons that you recommend? She goes, no. Like, you have to find one on your own.
Wow.
So I'm like, how am I going to find a friggin' surgeon on my own? So Christina knew somebody who worked with the surgeon that I saw, and she like highly recommended him.
Years ago, I had seen a doctor, and I explained to him that I was having all of these stomach issues. I was like, I've had these problems since I was 14, and I just don't know what's wrong, and I just can't live my life like this anymore. He basically told me that I was fat and I needed to lose weight and watch what I ate. And it wasn't my body, it was what I was eating. I left and I was really upset because, first of all, it could be the most random things I was eating.
And he didn't even do any testing.
No,
anything.
He was like, it sounds like IBS. Just watch what you eat and lose weight and you'll feel better. And I also had this problem when I was skinny at 14. I was tiny. And so I was like, that makes no sense. But I was just so frustrated with the whole situation that I didn't see a gastro for a while. So then I saw another gastro at the same practice, and he was such a dick. I went to see him and I told him what was wrong. He had me do a food journal. So he gave me the paperwork for a food journal, and it was only for 3 days. So I wrote down like what I was eating and I brought it in. He's like, where's the rest of it? And I was like, you only gave me 3 days of like paper. He's like, well, I told you to do it for a week. And I was like, no, you didn't. And he looks at it and he's like, well, these aren't the healthiest foods, but like I can't eat salads because lettuce is what like sets me off. So, and I told him this. I told him all my trigger foods. Anyway, so once again, no testing. He's like, well, this sounds like IBS. And then he asks me, have you ever been sexually assaulted?
What?
And I'm like, what the fuck does this have to do with anything? And I'm like, why? And he was like, well, have you? And I was like, yeah. And he said, did you know that studies have shown that 50% of women who have IBS were sexually assaulted?
What?
Yeah. So there's a whole article out there written by some fucking dumbass, I'm sure, that basically says you're more likely to develop IBS if you've been sexually assaulted. Because 50% of women with IBS have been sexually assaulted. I mean, I guess the whole idea is like your mental health and your physical health are so connected. And when you have anxiety, a lot of people present physical symptoms in the form of like diarrhea or constipation or nausea. And so I guess his thinking is like sexual assault causes mental health issues, which causes IBS. I don't know.
Maybe like schedule like an endoscopy or
Well, that.
or a colonoscopy.
Yeah.
Well, yeah,
Yeah,
that would make
colonoscopy,
for you and your
endoscopy. Yeah.
anything because
Any test. Anything.
And then if
Blood
there
tests.
was legit nothing, then okay, maybe it's anxiety or something.
Right.
Like there's legit no physical proof. But
Right.
like with nothing,
Right. Well, and then he was like, are you stressed? Blah, blah, blah. And I was like,
everyone is freaking
everyone's
stressed out.
It's like,
Is everyone
fucking
shitting their brains out?
Is
No.
everyone well? And so this is basically. So this is where this audience is about to learn so much about me. But it is what it is. But the thing that annoyed me is like, first of all, run some tests, like you said.
Yeah.
But second, do you think it's that women are sexually assaulted, so they develop IBS, or let me just put this
That
crazy.
sounds like
It
ridiculous.
sounds so stupid. Or let me put this crazy idea out there. Or do you think it's more likely that so many women have been sexually assaulted that if you take all the women who have been diagnosed with IBS and poll them on their sexual assault history, 50% are likely to have been sexually assaulted? I don't think, personally, the sexual assault causes IBS. I think it's just that so many people have been sexually assaulted.
It's just a
Specifically women.
coincidence.
Right. It's like if you take all these women who are diagnosed with IBS and you poll them, 50% are going to say they've been sexually assaulted because it's so common. What are the statistics?
Right.
It's like 3 out of 4 women will be sexually assaulted in the course of their lifetime.
Right, which is really sad.
It's really sad.
But like, how could you correlate both with barely any evidence?
You can't.
And
How
then
do you prove
asking
that?
patients before getting any physical data.
But I was like so
Oh my God.
shocked. I was so shocked.
That's terrible.
It was horrible. And then it gets worse.
Oh, no.
Because I had asked for, at a previous appointment, an accommodation for work because I had a hybrid work schedule. And all I wanted was to be able to switch my work from home day when I was having a bad day for my stomach. So I'm leaving the appointment and I asked him to fill out the paperwork and he was like, oh, my assistant can do it. And she's filling out the paperwork and she was like, what is this for? And so I explained it to her. And she's like, oh, I have to go get the doctor. So in front of the whole office, she gets the doctor and he asks what I'm asking for. And I told him, and he goes, I don't think you need this. IBS doesn't affect your life to the point where you need an accommodation from work. That's ridiculous. What I wanted to say to him was, have you ever shit your pants at work? Because I have. That's what I wanted to say because that is how bad my stomach issues are.
Mm-hmm.
Instead, I walked out of the office. I started hysterically crying. And 5 minutes later, I called the office and I said, I want to cancel my next appointment. I never want to see this doctor again. I was so upset. There are only 2 times I've cried after having an appointment with a doctor. And that's the other time was with a gyno who refused to like test me for PCOS when I had literally all the symptoms. And she yelled at me on the phone because she says to me, you don't have any symptoms of PCOS. And I said, excuse me, I have all of the symptoms. Were you not listening at all? Fast forward, I get a new gastro. And the first thing he does is he's like, okay, we're going to do a colonoscopy. That's literally the first thing. So we do the colonoscopy and he finds ulcers. And he's like, I couldn't see everything he needed to see. So I had to do it's like a camera that you swallow.
Oh. Ooh.
And turns out that I don't have IBS. I have Crohn's disease. So all of these years and all of these doctors who were like, you're fat, you need to lose weight, you have a shitty diet, it's IBS, it's because you were sexually assaulted.
Oh my God.
It's because I have Crohn's disease. And it's just so wild to me that it took me 7 years to figure that out because...
And multiple doctors.
Wow. Because these other doctors just kind of blow you off.
Yeah, somebody I went to high school with had it and like she was out like all the time or like late and it was obviously excused and she was like on my team and everything, but like it affected her life like significantly.
It does.
It
like,
really does.
I'm afraid to go out to eat with people because if I eat something and it just doesn't sit right, I'm running to the bathroom. I went on a cruise with my friends. We're at this island and I was like, we got to get the tacos. The tacos are so good. And I'm like, it's a 5-minute boat ride from the ship. It'll be fine, whatever. So we ate the tacos. I'm feeling good. We're walking back to the boat. And all of a sudden, I just get this cramp in my stomach. And I look at my friends and I go, leave me behind, go without me. So dramatic. And they're like, what's wrong? And I was like, I need to go to the bathroom. And they were like, it's fine, just come. And I was like, I am not going to make it. And they were like, there's a bathroom on the tender or on the whatever. And I was like, okay, are you sure? And they were like, yeah. So there thankfully was a bathroom. But I spent the entire ride from the island to the ship in the bathroom. And it was like horrible. And it's just, I'm so afraid to do anything where if there is not a bathroom, I can't do it because I'm so afraid.
I feel the same way. Ever since I had my gallbladder out, I feel like I have like a stomach disorder.
Probably.
Like that's exactly what it feels like. Well, it was funny because during my like first pregnancy, like I felt like that, and I'm like, I can't wait to like not be pregnant anymore and to like start like going back to normal, like going to the bathroom. But then I had to get my gallbladder out, and now it's even worse. But it really feels like I have like a stomach condition.
You might.
I might on top of it, but like I know a lot of people once they have that removed, like have like for the rest of their life have issues.
And it's
which I'm sure I'll be one. Yeah.
It's hard. It's hard to do anything. Like, it's not that I don't like doing certain things. Like, my friends are always like, oh, do you want to go on a hike or do, you know, even going on vacation, I want to do all of these excursions and these fun things, but I'm afraid to do them because I'm like, well, if there's no bathroom within like 5 seconds,
Right.
5 minutes is too far away for a bathroom too sometimes. Like,
It hits that quick. Yeah.
it hits that quick, and it's just, if you don't experience it, you don't understand it. It's really frustrating on a day-to-day basis because I have a lot of friends who just truly don't understand what it's like when I say, hey, I'm having stomach issues, and they're just kind of like, well, you always have stomach issues.
Yeah, you always do, but
Yeah.
there's days that are really bad.
Really
like,
bad.
Way worse than others.
Yes.
Yeah.
People are just not understanding. But for a gastro to not be understanding of that, it's like the same thing when you see like gynos or when you explain to them how bad your periods are, and they're like, well, it can't be that bad.
I remember when I was like, I first got my period, it was so heavy. Like, I probably had problems. Like, I don't even know. Like, but like for it to be that heavy, I remember like I would bleed through pads. And like whenever I went to like my grandma, she would make me sit on a towel when I had my period.
Damn, grandma.
So like everyone knew.
Oh my God.
But like it was like that bad. It's
That's
like
so
damn.
embarrassing.
Yeah, like I still remember it to this day. Speaking of like weird doctor stories. Well, it wasn't really weird. I had my like 20-week anatomy scan yesterday. So they told me to drink a full bottle of water before I got there because my bladder had to be full. I'm like, okay, but I didn't have to do this the last time. So I'm like, this is odd. So I went there and they start like doing the ultrasound and they're like, your bladder is super full. I'm like, yeah, they told me to drink a bottle before. They're like, I don't know why they tell you that. You don't need to. So I had to go and pee. I'm like, this is ridiculous. And then there was like a student, like a medical student in there too, like with the ultrasound tech. And when she was done, she's like, do you mind if the student like takes images or whatever? And she was literally just like for like 30 minutes, like just looking around like in my stomach.
She probably didn't know what she was looking
She
at.
had no idea. I'm like, wait, like me and Christina are sitting there like, this is just really strange.
Yeah.
And then the doctor came in like because she was like reviewing my images, and like your pants are completely all the way down, and they obviously have like a towel but like facing that way, so like the stuff doesn't get all over you. And like the doctor, I'm just laying there like pretty much, you know, everything out, and she's just like talking to me like normal. I'm like, this is just like awkward. I was like, I don't know. I'm like, normally I would have just been like in my clothes, and but like the student was like practicing. I don't fucking know.
That's weird.
It was really strange.
One time when I went to my old gyno, who the one I had to leave for religious differences, he needed to do an ultrasound on me. And it was like not a normal ultrasound. Like he did a normal one. And he was like, oh, we're going to have to do this other one. I had to make a separate appointment for this other ultrasound. And so when I was making the appointment, she was like, we need to do it between days 2 and 5. And I was like, okay, well, that's going to be hard to do because my period is so irregular. I think that's why. And I was like, okay, that's fine. So I book it. I go to the appointment and I had a tampon in because I have my period. And so they go to do the ultrasound. And I was like, okay, well, I'm wearing a tampon. Like, what should I just take the tampon out? Should I put a pad on? Like, and they're like, oh, you have your period? And I was like, yeah.
It's between, yeah.
Yeah. And she was like, okay, hold on. And so she runs out and she goes and gets the doctor. And he comes in and he's like, okay, we're going to have to reschedule it because you can't have your period while we do this. And I was like, well, when I scheduled this, she told me I had to be between days 2 and 5 of my period. And he was like, who told you that? And I was like, the woman I scheduled it. And he was like, which woman is it? And so I had to like point out which woman it was and describe her. And he was like, okay, I'll be right back. And I had been waiting for 2 hours at that point. So I was pissed. And he was like, I'm really sorry about the mix up. Like, she never should have told you that. I don't know why she thought that. I think she got confused with what the test was. But like, come back and we'll do it.
It's so aggravating because
so frustrating.
when I was like 21, like around that age, I was literally like, I would have my period, like whatever. It was like, you know, normal. And then when I didn't have my period, like let's say if I like worked out, I would bleed. So I'm like constantly always wearing like a liner at least because I'm like, I'm going to bleed, like, which is obviously not normal. So I had an ultrasound done back then and they're like, oh, you have a lot of polyps. Like you have to have like a polypectomy. So I did when I was 21. And then 10 years later, I was starting to have bleeding again. I went to this gyno and she told me, she goes, okay, like monitor it. And for your next appointment, I guess like a year later, if you're still bleeding a lot, like let me know and we'll do schedule an ultrasound. I saw the same one again and she was like, I told her about the bleeding and everything and she literally didn't do anything. And I was so pissed because I'm like, I know I probably have polyps again.
Right.
Me and Christina are looking to start having kids relatively soon because I told her about that like when I was at the appointment and she's like, oh, start taking prenatals right now. Like I'm like, what do you mean? Like I don't want to have a kid like right away. And she's like, no, start taking them now. Like you need them like 6 months to be in your system for like 6 months or more like before you start. I'm like, really? I'm like, I didn't know that. But if I have polyps, that's a problem.
Yeah.
So I was just like, whatever. I like didn't even like, I told Christine when I got home, I'm like, I was just pissed. And then when we finally went to the fertility doctor, like they had to run all the tests, whatever. Obviously I had a lot of polyps again and I had to have the damn surgery before getting pregnant, which I knew I was going to have to, but like I could have had it a long time. Like when I saw the regular OBGYN.
It's really hard to find good doctors and get good medical care. But I think the moral of the story is you have to advocate for yourself. And if you feel like something is wrong, don't be afraid to get help and don't be afraid to go to multiple doctors. It took me 4 or 5 gastros before I was finally diagnosed with Crohn's disease. And it's because I knew that it wasn't IBS. I knew what I was going through wasn't normal. You know your body and you know when something is wrong. So don't be afraid to advocate for yourself because no one else is going to do it. You have to be the one to advocate. And just keep looking for doctors until you have answers. And it's exhausting mentally. It's exhausting physically. It can be expensive.
But it's worth it.
Yeah.
And then if you know people who like have good recommendations, that always helps.
Sometimes it takes a while. And, you know, not everyone is lucky enough to have the access to healthcare that we have and have insurance. And that makes it even more difficult. It's rough in these streets. Yeah. Adulting is hard. It's a scam.
It's hard, yeah.
Truly a scam.
Really is.
Hope you enjoyed this episode where we talked about poop. Join us in 2 weeks where we talk about throwing up. I'm just kidding. Kind of. Maybe. Who knows?
You never know.
These episodes always take some sort of weird turn that we're not expecting.
Exactly.
If you like what you hear, don't forget to rate us. And you can also comment a review. We're on Spotify, Apple Podcasts, YouTube, Twitter, Instagram, and TikTok. You can find us at Tatas and Tea Pod.
Give us a listen.
Yeah.
Catch up on our episodes.
Yeah. All the episodes. Yeah. Or like work backwards. But if you're listening to this one, you might not be. I have some friends who can only listen in order. I'm that friend. But yeah, we hope you enjoyed this episode. And
see you next time.
Listen up, fans. We're Tatas and Tea, where we turn our traumas into comedy. But we're here for some fun to retell our life tales, from hilarious dates to epic fails. You want some advice, just ask away, but we'll share our opinions either way. No problems too big, no questions too small. With Tatas and Tea, we'll